For your another session of First Aid for All. In this session, we will be trying to cover 4.3 and 4.4. This will be the last session that will be covering the snake bites and what is the first aid for them. And in 4.4, we will be trying to cover what are the first aid things which we can do for the emergency situation, like it's a fits, seizure, or an epilepsy condition. So let's begin with students. While there are more than 2,500 kinds of snake bites which we can see all over the world, the effect of snake bites bit vary depending upon the types of snakes it is. Not all the snakes are poisonous. Not all the poisonous ones are lethal. So, but one should be very much careful when we are dealing with any kind of situation like a snake bite. Also, snake bites should be treated as they are in poisonous bites. Snakes rarely strikes when they are being threatened or harmed. So we have to make sure that we are not doing anything on this situation or to the snake which is going on the side of the one. So let's see what we can inquire on the situation where we find a casualty or a victim which we are suspecting of a snake bite. First, we have to see whether is there any bleeding on the site of a bite. Is there any swelling, bruising, pain, numbness, or weakness? These are the most important signs and symptoms which we can see in terms of any kind of a snake bite, followed by a confusion, affected speech or vision, nausea or vomiting, cardiac arrest, or difficulty in breathing. That also will follow in the later health of the time period. So at first, when you see any kind of a patient with a snake bite, please make sure you are handling with care, and after seeing all the signs and symptoms, proceed as per the situation is concerned with you. So let's see what we can do. First, safety. We have to see whether you are safe or the person is safe before you are going to handle the particular patient. The area should be safe enough for before you assess the person. Then, if the person is urgently needs urgent help, then if you are alone, call out for help. Do not leave the patient unattended. But if you are with someone else, ask the bystander to go and call for help and wait until the he gives the confirmation. By the time you have to stay with the person or the victim of the casualty and make sure you are making them as calm as possible and as comfortable as possible, because too much of movement can also make a panic attack. So that's why we have to be very much secure in that. Provide the first aid. First, as I told you, comfort the person. Help the injured person to lie down and tell him do not move. Offer them comfort and keep the person as calm as possible, but do not restrain them forcibly. Keep, keep your voice as cool as possible and as calm as possible. Tell them if you move so much that it can spread the venom. So we have to make sure that there are no such moments happening. Watch the person for any kind of change in the situation like breathing or consciousness level. We have to check whether there is any alteration in this. Put on the gloves if it is available. If not available, try to take a clean plastic bag and cover your hands. We don't want any kind of blood coming in contact with the person who is treating or even you as a first aider. Because as you have known, there are so many cases of first aid, HIV and AIDS. So in case you have an open wound and you are treating the person who is bleeding too much, and that time you won't be able to know whether the person is having the HIV or AIDS. So we have to be very much careful when you're treating the patient or any other patient in any kind of situation. If you see any kind of a casualty, try to put the glove or a clean piece of plastic so that you are making sure the person's blood are not coming in contact with yours. Next, this is the way you need to calm out the patient. Try to put them in recovery place and put the gloves on. Do not suck or cut the venom out of the skin. As you can see in so many movies which was there in 90s, 80s or 2000, they usually suck the blood out of the skin. But that is not the way you have to do it. When you are sucking it out, that this venom is coming into your mouth as well. That means you are making your life in danger and there is nothing is happening to the person. The venom is will be going into the blood again. So do not do any kind of things such that. Do not rub the herbs on the bite. As we say, these herbs will be very much important, but we don't know what is it, whether it will be wild one or whether it is a medicine one. So do not rub anything over there. Do not apply a tourniquet. Tourniquet are nothing but a place where you are trying to put it up, a belt kind of an area. If you can see in this particular image here, this is the tourniquet like a belt. And if the cut is here, do not put it up here. Maybe the circulation will be impaired to that area, and that can again cause another issues. Do not cut an area, do not rub any kind of herbs here. And in case of there is any kind of rings, bangles or watch or any tight clothing, please remove it up. Make sure the blood is flowing in the way it has to. Do not move or try to move the injured limb. Try to put a splint to immobilize that affected area. Cover the wound with a clean cloth and bandages. Once the action to be obtained has been taken, stay with the injured person until the help is arrived. Observe the condition of the person, whether he is conscious or is breathing. Arrange the urgent transport to the nearest healthcare facilities or the hospital. What to do if the person is unconscious but still breathing? Here we still have a hope. So if he is unconscious, just put him down in a recovery position. Continue to observe whether the victim is breathing, whether is there any change in his unconscious level. And now, if it is unconscious but he is not at all breathing, immediately start the CPR. Do not interrupt the resuscitation until the person wakes up, open his eyes and breathing normally, or the trained performer or the trained CPR person has arrived already, or you have become exhausted and if the area become unsafe for you to continue the same. Next, what you have to do when you cut down the venom got into your eyes. This is a very serious condition situation when the venom is getting into your eyes. So you have to pour it on, wash it off as fast as possible. Clean the eye with water, rinse it for 10 to 15 minutes with the clean water. Pour the water from the nose to outward. As it has been shown here, if you're alone somewhere on the side, from here you need to pour it up towards the outward area so that you are not getting again the venom is not coming in contact with you. What to do? The person is bitten in his leg. This is again an emergency situation. Immobilize the leg by bandaging it to the other leg. The one side will be correct, the unaffected part. The affected part should be bandaged with the another side of the leg. Split leg with the snake bite wound, and to do so, gently bring the good leg to the bitten leg, and then use the stick or a splint to the limb and bandages to the place with the clothes and clothing. It's somewhat around this way. This is the way you have to put it up so that you are knowing, you are trying to make sure that area has been clearly managed and you are trying to take the persons in the particular area and you are taking all the legs to be in one leg so that the movements are being very, very lesser. And as I told you, if the movements are more, the amount of venom that is passing through the areas or the blood vessels also getting more. To do so, if the person is bitten in the arm or hand, hold the arm still. Tell the injured person to immobilize the arm himself by holding it close to the body. If it is cannot be done due to any reason, immobilize the arm with a triangular bandage. So holding the particular area which is bitten is very, very much important. So if he is not able to hold it up, immobilize it with the triangular bandage. As I've already told you how to make a triangular bandage, so it will be easier. So how to do when you are bitten and you are very much alert? And you himself as a first aider, you are being bitten up. So if possible, try to move as little as possible and call out for the help. And let someone come and help you out. Remove all the rings and jewelers and make yourself all the tightened clothes should be loosen it up so that you are being free. If you need to move and find the help, restrict the movement of the limb which are being affected and the bitten up as much as possible and try to limit the brisk movement. All the small sort of movements have to be stopped or limited for the place where the snake has been bitten. Go to the nearest place where somebody can give you or provide you the help. Always seek the medical help, not from the anyone in the homemade or the ready-made things which you are trying to get it, but no, just go to the medical or the facilities to get the help. Insect sting and bites. These are also very much common in day-to-day life. So let's see what you can do as a first aider in this. Most insect bites and stings cause small reactions that are confined to an area or the bed or sting, a local reaction that can usually be treated at home. Insect sting inside the throat can be dangerous due to potential swelling and it can also be a life-threatening situation. So whenever it is there in something you feel like it is there inside the throat where someone has or a wasp or the hornet has been hit on your throat, then you should seek the help as fast as and as early as possible. Next is the mite ticks and leeches are also found in marshes and jungles, and during this kind of a rainy season, we usually find the leeches all around. So they are attached themselves firmly to the skin, and mites and ticks might carry the typhus. That means to make us sick with the typhoid situation, and might also transmit to the other person. Ticks can also transmit the Lyme disease. Leeches are mostly harmless. They just come to the host and suck the blood, nothing else other than that. The effect of sting from the scorpion and the bites of these spiders are very, very, very dangerous because some are very poisonous and which can cause a life-threatening situation. But not all the insects are poisonous, but we have to be very much careful when we are been getting bitten by someone. So what to see and inquire? If the person is stung or bitten by an insect, you might see pain, again, swelling, redness or rash, itching, and some animal might be stuck into the skin in itself. You may not be able to fly, then that is again a situation. Some people experience an allergic reaction. This is very much important. We usually say this allergic reaction as anaphylactic shocks. These anaphylactic shocks are very life-threatening if it has not been um, like treated the way it has to be and as fast as possible. This reaction can be localized or it can be systemic. A systemic allergic reaction requires immediate medical attention as it is potentially life-threatening condition. So a person with the systemic life-threatening may show the following symptoms. They can be having rashes, they can have itching on that area, they can have the wheezing, hoarseness of voice, difficulty in breathing, dizziness or feeling faint, difficulty in swallowing, a swollen face and lips. If you can see if a person is having allergic to seafood and he grabs seafood, his face will get swollen. It's the same as in case of the insect bite as well. Nausea, vomiting, and diarrhea, confusion, anxiety, or agitation. This affects the bites or the sting from scorpion and spiders vary accordingly to the type of animals they are, but not all the insects are poisonous. So what to do? First, your safety, as I told you, make sure the areas are safe before you assist. Try if your area where the wasp and hornet is still around, walk calmly to the safer area with the victim. If attacked by the swarm, run as fast as possible and get a shelter. Provide first aid. Ask the person to keep calm. Then, in case of a bee or a wasp sting, remove the sting of the bee, and wasps or honey usually don't leave the sting behind, only the bees might leave. So, as fast as possible, take the sting out of it. Use a fingernail or edge of a bank card or whatever thin, sturdy material that you find. Even if you have tweezers, you can take them out of it. Remove the sting, which can be easily be done by pushing upward from the beneath the sting side and slide the sliding movement. So if you can see here in the photograph, if there a bee might have stung it and we are trying to take it with a fingernail. You can even use the bank card or any kind of tweezers to take it out. In case if it is a tick bite, sometimes a tick will be there with the body itself. So removing the tick with the fine tweezers, or not with a finger because it might hit you back somewhere else. So that's why take the tweezers and grab the tick as close to the skin as possible. Pull it firmly until the tick's mouth part is away, has been removed from the body. Do not twist or jerk to the tick to remove it. Do not use any petroleum jelly, alcohol with the match or cigarettes or any other method to remove the tick. In case of a leech bite, so mostly what we all are doing is to try to take the salt and put it over the leech. Do not do that. So if you find one leech on the person's body, but trying to check any other leaves are there or leeches are there in the entire bodies or not. Slide a fingernail on the edge of the bank card, whether it's a thin or sturdy material, you have it in hand, under the sucker mouth, not on the tail, but on the head of the leech, and fickle it off. Do not try to squeeze the leech. The person may also consider the leech to fill up and fall by themselves, but do not put the salt on the leech or burn it as it will make the leech to vomit back into the wound before it falls off. Leech bites tends to bleed for a longer time, so please apply a small bandage and change it frequently so that the bleeding is stopped and the infection has been managed. Wash the sting or the bite side and wipe it away by any venom. Next is do not suck or cut the venom out of the skin. Again, as of the same as a snake bite also, you should not suck it or cut the venom out. Again, do not rub any kind of herbs on it. You can use ice, but do not use directly on your skin. Try to put it in the towel or a clean cloth, put all the scoops inside, make it like a vomit, and then you have to put the ice cube. In case you don't have an ice cube, try to use the cold water as well. That can also be warm. Do not cool it for more than 20 minutes at a time. Just give it for max to max 15 to 20 minutes and then you can stop it and you can give it next time. You may raise the leg of a person who is suffering from an anaphylactic shock. Shock can, as I told you, anaphylactic shock is because of the reaction from any sort of bites. But there can be the insect bite or the wasp bite, they can have an anaphylactic shock. Then, as fast as possible, rush to the medical help facilities to get the help. Next is our next session is 4.4, that is the fixed convulsion and seizure. A person has a fit if suddenly shakes uncontrollably. It is different from the normal shivering and trembling. It may manifest in all the limbs or just be limited to a single limb. A person having a fit may urinate and defecate without control because when you are having, if you see a person who's having a seizure, they will be having a contraction all over their body. So if the contraction is way too much, they can even harm their tongue. So they can even urinate and defecate at times. A fit can cause by a high fever, diseases like malaria or epilepsy, poisoning like alcohol or drug, or a trauma like a brain injury. The fit is entirely different, and the seizures or the epilepsy, if I have to put to it, epilepsy is entirely different. Seizures and the fits are coming just because of a primary cause there. Like if there is, as I told you, if there is a fever, then you might get it. If there is a poisoning, you might get it. But epilepsy is a condition where you will get the seizure. So, the epilepsy is a central nervous system disorder in which the nerve cell activity in the brain becomes disrupted, causing the seizure or periods of unusual behavior, sensation, and sometimes cause the unconsciousness. It may be minor and major as well. In the minor epilepsy, the casualty will be not having any issue. They will just stop all the work and stare at one point. After a few seconds or the minutes, they will come back to do the usual work, and that for the few minutes or seconds they will be having a blank memory. The major one is known as grandma's seizure, and which is very serious, where they all have go on uncontrolled convulsions or the contraction of the body throughout the body. What you have to do to inquire it is what signs and symptoms you can see. First and all, you have to see a sudden uncontrollable shaking, falling down to the floor, loss of consciousness, foaming at the mouth, or the person might also have an earlier that have smelled. This is smelled, felt, tasted, heard, or swing. So these are nothing but the aura. These auras are very, very seen in case of an epilepsy aura cases. Before even getting this kind of episode, they usually have an instinct that they are going to get it. If the fit is due to high fever, the skin might feel very hot and look reddish. In case of these fever cases, it usually happen for a child or infants when they are having a very high seizure and they are in danger to go into any kind of convulsions. What you have to do here? First, you have to make sure there is no danger for you and the bystander and the person you're going to treat. Provide the first aid. Remove all the objects that could hurt the person. Make the clothing easy. Do not hold the patient and restrain them. Let them calm down with their episode. If possible, put the cushion under the head if the person is lying on the floor so that the head is not be hurt. So you should not restrain themselves. Don't put their leg, hand, or make them forcefully stop the convulsion. Don't put anything on their mouth as well. Make sure the person can breathe freely by loosening the tight clothing around the neck. Just loosen it up so that they are, even when they are having a contraction or convulsion, they are breathing freely. Do not put anything inside the mouth of the person or the casualty, not the road, no wooden plank, nothing, not even your fingers. When the fit stops, put the person in a recovery position. If not yet in this position, this will keep the breathing passage open and prevent from vomiting entering the lungs. So when you're putting in the recovery position, what happens that the passage, which the airway passage has been open for them and they are breathing it more openly. And in case they are going for any kind of a vomit situation, you can just turn them out so that they vomit out so that their vomit is not coming and entering back to their lungs. Stay with the person until they gets better. Reassure the person and the patient, the person, parents, and the bystander. Do not give any kind of water, drinks, or food during the person who just had the fit. Urgent transport to the nearest facility. If the person has very high fever, then it has to get treated. The person did not wake up in between the fits. Fits can also be an episode, like 2, 3 episodes in a time. So if the person is not waking up in between the fits, then we have to give the emergency care as fast as possible. If the person stops breathing or the situation gets even worse. The person, it was the first fix that he has seen which doesn't have any fever with it. The person is under the influence of drugs or alcohol. So all this situation, we have to make sure the person is rushed to the medical care facilities to seek the help as fast as possible. What you do when you see a child with a very high fever? Remove all the clothing and blankets. Ensure there is enough fresh air. Do not make the child too cold. Put the pillows and soft padding around the child so that it cannot hurt himself. See, what happens is, with the child with the high fever is a very very harsh situation. So at this moment, if you're trying to give them the blankets and make them even more hot, the temperature might rise very fast. So make sure you are just remove that clothing, remove all the blankets and whatever is causing too much of hotness to them. Just remove it, but make sure you're not switching on the AC or fan at 5. No. So you just have to remove it, make it a little bit cooler for the temperature to come down. You can even use the water, the handkerchief or the cloth soaked in water, and on the extremities, if you try to put the cold water or the water soaked in, cloth soaked in water, that can also ensure that fevers can come down. But we should not make sure the child isn't too cold. Then again, it will be another different level of situation. We have to put the soft pillows and padding around the child so that he is not hurting himself. Put him always in this kind of position, so even he is on the sideline position, even the kid is about to vomit, or they don't know they want to do something else, and they sometimes they vomit so much that it can stuck in the airways or the nose airways as well. So just put in this situation, so even if they want to vomit, they'll just vomit it out, and the vomit, due to the gravity, it will come out only. So with the child, we have to be very, very, very much careful so that we are giving the adequate amount of proper channel, but we are giving them the secured areas as well. If possible, put the child in recovery. Sponge the side with water at the room temperature, as I told you. Always use the water or cold, the clothes soaked in water, and give it to the extremity and clean them off so that that will also reduce the high temperature. Next is hygiene. Always wash your hands after taking care of a person. Again, if with the sanitizer or the soap, you can wash it off. Next is when you have to refer to a healthcare facility. Always arrange your urgent transport to the nearest facility if the person has more than one fix. Again, if the child has more than one fix and he has not waken up in between, the person has high fever or the person's condition is deteriorating always. Always refer to the person who has a fix to the healthcare facility for the further treatment. If we are not doing so, okay, it has become calm down now, let's make no issues with that. Please do not do that. You have to make sure the child is reaching to the healthcare facility and getting the attention that he needs so that there is no other episodes in the future. So you have to make sure we are being looking forward for this all these conditions. Thank you so much, student. This was the end of the first day for all sessions. I hope you, all these sessions have been useful and you will be using it in your day-to-day life if you see one of them. So make sure in this condition, when you're looking forward with a fix or convulsion or in epilepsy cases, make sure you are giving the time to the person and to the child to get them recover. And once they recover, if it is the first time, please rush to the hospital as fast as possible to get the medical condition and to see whether any kind of underlying disease the child is having or not. So with this, I want to thank you all, everyone, all the students. Please make sure that you have the learning outcomes, whatever you are grabbing in this are being useful and you are using your day-to-day life. Even if it is a cut, if it's a bruising, you are trying to give the medical attention and make sure you have a first aid kit with you so that it's very much easier and very much comfortable for you to get them out. Thank you so much, students.